The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, all you TMD warriors out there. I am Tony Urbanek, and this is TMD Demystified. Today, we're going to discuss a very pragmatic topic that I think all of you will be interested in, whether or not you're already a network provider or you are someone who's considering being a network provider and providing TMD services using our device and protocol, the Urbanek device and protocol. I think we're going to entitle today's episode, Treating TMD, Your Practice Potential and Benefits. Treating TMD, Your Practice Potential and Benefits. Earlier in the episodes, I think I covered this somewhat superficially. Today, we're going to take a deeper dive into actuality. I like actuality, exactly what it is that can be produced, that we produce for the benefit of your patients, for the benefit of the practice, for the benefit of your practice, for the benefit of all the people, the thousands, hundreds of thousands, millions, primarily women who have TMD symptoms. So let's just start out this way. Every month I get a report from my staff for my practice here in Brentwood in Middle Tennessee regarding several issues. But the report I'm speaking of is the report of the number of patients that were referred in by other practices to treat TMD patients. And we're recognized. I was just reminded by a business associate that we're doing business with about our leadership and the high visibility that we have here in Middle Tennessee and on the internet. I was surprised. There's an internet supplier, and he surprised me. He did the investigation, and the visibility that we have on the internet regarding treating TMD patients. We won't go any further on that right now. Maybe I'll bring an expert in to discuss that, because I'm not. But I do get a report at the end of every month or the first day of the following month for my staff members on different topics. And this report covers the number of patients we see referred in for TMD and the names of the doctors or the practices that send us patients, and whether or not those patients, after consultation, went on to receive a device. So actually, here is the report. I'm not going to, make the time to put it on a grid and so you can look at it independently. But I'm going to talk about this a little bit to begin with. In March, we had 86 consultations referred in, and now, because I've completely pulled the plug on doing any kind of office surgery, the practice is totally devoted to the non-surgical treatment of TMD. I don't recommend that for everyone. I think if you're a general dentist, an oral surgeon, or orthodontist, you want to continue on with your treating of patients like you used to do with TMD treatment as a supplement. Or we do have a couple doctors whose plan is to actually direct their practice to the exclusive treatment of non-surgical TMD. Two in particular that I'm thinking of. One is a general dentist, one's an oral and maxillofacial surgeon, and their plan is to bring on an associate to do the, as we called it, wet-fingered surgery, or wet finger dentistry or surgery, and they're backing out as they are getting older and just want to do something that is less stressful, much easier to do. This is truthful, much easier to do than taking out wisdom teeth or prepping crowns. And much more satisfaction involved, actually. But getting back to the point, so this report comes to me, and this month, the last month in March of 2022, we had 80 TMJ consults. We took impressions for 52 devices, and what I want to discuss in particular is 16 new referral sources for last month. Now, on these reports, I think you can see that some of these names, and I don't think you can read them off the internet, but these names are doctor names, practice names, and some of them are highlighted in green. And so there's 16 names highlighted in green, and I got very interested because we usually get about 8 to 10 per month of new doctor providers, meaning practices of various kinds that we had not had referring us patients before. In March, we had a significant increase to 16. And I did a little extra investigation of like what kind of practices, because frankly, at this point in our practice, with my associate doing the majority of the patient care and me doing only 25% of it, I don't get to keep up with the daily, doctor names and who referred them in, and I certainly don't know them personally. But we had, out of those 16 doctors, we had a scattering of, which surprised me, 2 chiropractors, 1 pain management physician, and 1, 2, 3, 4, 5 primary cares, and an ENT. There were, the remaining were general dentists, as I assume dentals, it said dentist, and now that frankly could have been, possibility of that being an oral surgeon or an orthodontist, but let's just say they were all general dentists. So those are new providers sending us patients in 1 month. So we have now, I don't keep track of it on a month, but we have over now 700, I don't know what the over number is, over 700 doctor referral sources here in Middle Tennessee who have acknowledged that they can recognize the symptoms of TMD, headache, earache, jaw pain, neck pain, ringing, fullness, dizziness, shoulder pain, arm, hand, finger tingling, and numbness and locking, and refer it on, which is what our objective was. Several years ago, when we started using our proprietary marketing method, which is quite simple, I've talked about it before. How do you market? And marketing is just making people aware, making doctors aware, making patients aware that there is this service, that there is this successful service. So marketing is not a dirty word. We've talked about that on separate episodes, but so we now have gotten to the point where we're getting over 10 to 12, and in last month, 16 new providers. That's unheard of. When I practiced oral and maxillofacial surgery, whether it be major facial reconstruction, which I did for the first 20 years, and then major facial reconstruction, which was supplemented by office surgery, implants, extractions, and dental implants for the last half of my career. If you got 1, 2, or 3 new providers a year sending you patients, that was a big deal. That was a huge increase in your practice load. So you can imagine what the opportunity here is, and there's no reason that not a single doctor out there listening to this cannot duplicate what I've done here in Nashville. I'm certain of it if you follow the steps that we take. And the awareness program, i.e. marketing program, awareness program, is not directed to patients. It's directed to the doctors who misdiagnose it, mistreated, and misdirected, and can't determine in the first place that it's TMD. So regarding the opportunity for the benefit of a practice who takes this on, depending on how well you adhere to all the little steps, which the company TMJ Services does for you, you don't have to market this. That's the whole point. What we offer, again, we're talking nuts and bolts, practical now, of what are the benefits and practice potential for people who get involved in TMJ Services, the company, and the Urbanic device and protocol, the product, what it can mean for you, your patients, and your income. So I've mentioned before, we did an investigation several years ago. The average, and this was several years ago, like 4 or 5 years ago, the average fee for a non-surgical TMD service in the United States of Tennessee, coast to coast, higher on the coast and less in the mid part of the country, depending on circumstances, and the large metropolitan areas are more. Rural areas are probably less. Is $1,800 average throughout the country, and that was 5 years ago. So we can do an investigation again, but right now, that's my knowledge. So you can multiply the numbers of patients that are available, the number of referral sources that are available, to how big you want to build this service for your practice. And again, we do the marketing part, the awareness part for you, because the company became aware, people involved with me became aware that unfortunately, doctors, you're not going to be able to, you don't do the marketing. You don't want to do it, can't do it. More importantly, can't get your staff to do it, because you're not supposed to do it. You're supposed to be the technician. You're supposed to be the provider. You're supposed to be seeing the patients and providing the service. And unfortunately, the doctors out there can't get their staff to do this simple marketing program that we've developed. To drive in March of 2022, 16 new providers who send us patients. So now we have well over 700. So, and the second point to carry this a little forward is it varies between the effectiveness and how this works out varies somewhat between whether you are a general dentist or whether you are a specialist, specialist being defined as either an oral or maxillofacial surgeon or an orthodontist. Those three types of practices are well positioned to treat TMD. So let me explain. First of all, as a specialist, as an oral maxillofacial surgeon or an orthodontist, because you are not competing with general dentists as far as the services for the most part, and I think now orthodontists, and to some degree oral surgeons too, we're competing with general dentists who want to do their own dental implants and take out their own wisdom teeth and extractions, and orthodontists are now competing, and it didn't used to be that way. I mean, general dentists didn't do orthodontics, but things have changed. So orthodontists are now competing with general dentists to do orthodontic services. But it works out because you're less of a, let's just say less of a competitor than your buddy who is also a general dentist a half a mile away from your office. We have access to general dentists and other specialists who we refer as TMD patients. That's why I see on a routine basis referrals from my oral and maxillofacial surgery colleagues. I mean, they don't want anything to do with treating TMD surgically or non-surgically. And I think that would go along with orthodontists, but as specialists, we have access to the general dental community who for the most part also don't want anything to do with treating TMD for the most part. And those that do, we've discussed what they try to use and the modalities they try to use, which are nowhere near as effective and at best treat one symptom at a time when the symptom complex is very complex and not usually, almost always, like 98% of the time, includes other symptoms that are ignored when it's just focused on putting Botox in one set of muscles, and the rest of the symptoms of TMD are just ignored, and that's called treatment. As I've said many times, everybody, and I mean everybody, medicine, in the medical end of it, and the dental end of it, and the nurse practitioner end of it, and the cosmetic end of it, if you have access to using a syringe, you're more than likely injecting Botox into somebody. So the specialists have access to a larger range of the general dentist, because as a general dentist, it's highly unlikely you're going to get referrals from one of your general dental colleagues, because they're going to be afraid that then that patient will end up in your practice as a routine every 6 months or better general dental patient who gets all their general dental services or all of their dental services from you. Fear not, the general dentists have access just as much, even more, I think, to the potential referral sources that the specialist has. So not to confuse you, as a specialist, I have physicians of many kinds, nurse practitioners, physicians assistants, walk-in clinics, and all the general dentists out there that are aware already that we have a service that actually fixes patients with TMD symptoms. The general dentist, on the other hand, is not going to have access to the general dental colleagues for the stated reason, but they have access to what we found in the medical community as the low-hanging fruit, which now is expanding rapidly, becoming more and more common, familiar in all areas of the United States in our medical system, and that is immediate care clinics and walk-in clinics, as it's referred to. It's no secret to anybody that access to an actual MD physician, generalist or specialist, is getting more and more and more difficult. And when you do go to Dr. so-and-so, and the name is on the practice, it's most likely you will see a nurse practitioner or physician's assistant either before or in addition to, or maybe just only a nurse practitioner or physician's assistant rather than the doctor, depending on your level of a problem. And that shows itself in all of the immediate care clinics that are now popping up in grocery stores and pharmacies. And of course, here in Nashville, I mean, every community, every small within a square mile, you'll have, I mean, from where I'm sitting right now, I can probably count within a mile of where I am right now, I can count 8 emergency walk-in clinics from a mile from where I sit right now. And that is the area that the general dentist has access to that needs to be mined, and we know how to do that easily. And here's the issue. I did a lecture presentation to the Tennessee Association of Physicians Assistants in Gatlinburg, Tennessee, about 5 months ago. And what I learned from presenting to physicians assistants rather than dentists or even physicians is that physicians assistants know that they don't know. Where presenting to, especially a dentist or dental organization or dental group, when I present, and I have many times, the material and how we've figured out the actual successful treatment of TMD non-surgically. You know, there's so much skepticism, confusion, because they operate from different points of view that they heard of or learned of whatever. So they already know, a good portion of that group already knows. Physicians the same way. They look at things differently. They know they don't want anything to do with TMD, TMJ problems, but they have their own point of view about using drugs or sending patients who have certain pains and complaints to physical therapists. My last episode covered all of the, let's say, competing treatments. And I would never say they don't have any value. I wouldn't say that. I don't need to say that because that's not true. But they only treat, as I said before, like one symptom. And when you actually investigate the patients, they have inflammation within the temporomandibular joint, and they usually have 5, 6, or 8, and many 10, all 10 symptoms going on simultaneously that's just being ignored, and the inflammation in the joint is being ignored, not treated. So you, as a general dentist, the low-hanging fruit now, and is increasing in great numbers, is the nurse practitioners, physicians, assistants who man, or I'm not sure how to approach this one, as females, man, the walk-in clinics. And they know they don't know. And so when you present with them the concept that they're misdiagnosing, and they do all the time. We know that, we see that constantly. Misdiagnosed migraine headaches and infections of the ear, which are not infected ears and not migraine headaches. They misdiagnose those as migraines and infections and treat them with migraine medication and or antibiotics for infection when it's actually TMD. And the simplicity is all you have to do is push on the joint from the open and closed position. And if it hurts, the joint's inflamed. If the joint's inflamed, that is the definition of TMD. And then if, obviously, as you know, or should know by now, then if you decrease the inflammation by unloading the joint, the inflammation goes away. And when you teach a physician assistant that, their jaw drops open, their mouth drops open, and because it's so simple, and it indicates, and now you have a supporter forever. And they see boatloads of patients that then they realize they've been misdiagnosing these problems, and they will send it to the appropriate source, which is you. And then it's a matter of how many patients do you want to see? So, I mean, we saw, what was the number, 86 consults last month. We took 52 impressions, which is about the average. When the patients come in here to this practice, without exception, I mean, like, I can't remember the last patient that came in here that when we did the exam and we took the history did not have TMD. They've kind of been sorted out for us already, for the most part. And there's always an outlier. And I have said, no, you don't have TMD. Something else going on here. I mean, I talked about earlier, I mean, I actually picked up 2 patients with occult cancer that had facial pain that was similar to TMD facial pain, but it was an occult cancer. So you got to be careful. But the point is that you have this large number of primarily physician types, starting with the low-hanging fruit, walk-in clinics, and then you go to the PCPs. And then, like I said, last month we had a new ENT. ENTs, I mean, we have a practice of 3 ENTs we see at least 3 a week from that one practice. So the problem is misdiagnosed, and when the physician's assistants or PCP doctor or ENT realizes that, yes, you can do a very simple procedure and rule in or rule out inflammation of the joint, which is the cause of their particular symptoms they're investigating. ENTs frequently tinnitus, subjective hearing loss, and vertigo, along with ear pain, ear infections. The PCPs hear about it all the time, walk-in clinics. 2 chiropractors this month came out of nowhere. They're starting to kind of say, wise up. And they're all good doctors. They want to treat their patient. They want to see their patients successfully treated. So, eventually they go, oh, I know how to distinguish TMD from an actual ear infection. I know how to distinguish TMD from an actual migraine headache that is not caused by inflammation within the temporomandibular joint. And now I know what to do with them. I send them over to the TMD practice. So that's the potential, and that's how you get the potential. And I was kind of saying before, and I think I lost my track, is like, you may not want all these patients because you will gain a huge following when you do this correctly, when you do the technology correctly, the technique correctly, device and protocol. A huge following, and it's easy. It doesn't take time. I mean, the practices, the TMD gurus out there who spend hours and hours, and I don't exaggerate this, you can invest in hours and hours just on the consultation. That isn't how you treat TMD. I mean, in our practice, my associate and myself and the doctors who follow our protocol, I mean, you'll spend 15, 20 minutes doing a consultation, and then the rest of the protocol overall, you'll spend another 15 to 30 minutes treating the patient to final success and discharge. I mean, you'll invest 45 minutes on average. I've talked about that and how that works out. On average, no more than 45 minutes. So, the solution is simple. Treating these patients is simple once you understand what you're doing and why you're doing it, and the nuances involved and the variations. So increase your income significantly. You can imagine, you just do the numbers, multiply it out, how many patients you want. The satisfaction, I mean, I gain much more satisfaction out of doing what I do now than I ever did taking out wisdom teeth, for sure. And as you all know, this is a patented device, FDA cleared and approved, not covered by insurance because it's a medical device. It has no CPT code. So you don't have to deal with insurance. It's a cash only device. Getting back to the numbers that I gave you, some of them may have questioned. We had 86 consults, but only 52 impressions. And I just did the calculation on that. That's 62%. Everybody wants the treatment, but only 2/3 of them, it varies a little bit between 60 and 65% over the past 7 years, have income, a job of some kind. And if they do, they get it. And it works out in Tennessee. I don't know, maybe in other cities it's a higher percentage, but here in Tennessee, and we are in a very affluent county, but I get patients from, at least half my patients from outside this county, who do not have a checkbook, they don't have income, they don't have a job, and they don't have a parent that'll support that, and therefore they don't get it. They want it, but they don't get it. And we have multiple avenues to fund that for them if they have resources of any kind, a job, a checking account, or any interest at all. We're totally for the patient, but those are the numbers. So 2/3 of them get the device and 1/3 don't. It's cash only service, but that is extremely good benefit nowadays when everyone who is in the medical dental industry, patient care industry, is looking for a niche of some kind where they don't have to get involved with insurance. I'm not speaking out of line. It's the truth. Maybe insurance companies don't want to hear about it, or you don't want to say it, or patients don't want to hear the truth. But us doctors, I started out in the golden age of medicine. I won't talk about that, but that's what it was called. It was a great time to be a doctor or a dentist or an oral maxillofacial surgeon. It was wonderful when I started my career. And at the end of my career here, between, government mandates and insurance company squeeze, it just got to be no more fun at all. You spend so much of your time and your resource time with your staff members, keeping records and following, all the things that, are mandated to follow now to be a licensed dentist, physician, oral maxillofacial surgeon. That's why, unfortunately, some of our best doctors are bailing out as soon as they can. That's a fact. And you all know that. So back to potential benefits, it's easy. And the service that we have available, that's why the company is called TMJ Services, using a device and protocol, is turnkey. And basically all you need to do as a provider is actually learn the technology, take the course, learn the nuances of what you're doing, why you're doing it, how to treat the patients. And then once you get that knowledge under your belt and you have that thoroughly understood, then it's just treat the patients, and the company, TMJ Services, takes care of all the marketing, awareness, driving in huge numbers of patients. If you're a general dentist, from primarily the medical community, primarily now walk-in clinics, but also PCPs, ENTs, you get a few ENTs sending to you, that may be all you need or want. And then if you're a specialist, an oral surgeon or an orthodontist, then you have access to the general dental community on top of the medical community. The numbers of patients will only be limited by the time you're involved with us developing the marketing awareness program, because it takes a little time. You don't get 700 referral sources in a month, but you do get 12 to 16 in a month if you do it according to our little program. So I've covered the points. And pragmatic, practical, truthful, valuable for you as a practitioner who wants to be successful financially, successful treating your patients, with great satisfaction for you, the practitioner, and great satisfaction for the patient. So I'll just leave it at that for today. I'll let you think about that. For any new providers, doctors who have not viewed our episodes or our podcasts, I invite you to look at other episodes. I think I've explained all the aspects of our treatment at one time or another, and who we are, what we do. And I encourage you to communicate with us if you'd like. I am available at Tony Urbanic I am available at tony@tmjservices.net. Almost gave you my personal email account, which some of you have. If you're a network provider, you do have. And Naomi at tmjservices.net, our director of marketing and patient and provider education, patient education. The website is www.tmjservices.net. And I encourage you, if you're new, to investigate it, because everything that I say, everything that I have said, everything that I presented, including our independent study now that is out, independent study based on 3,000 patients, is the truth. We are extremely open to any investigation or knowledge, to put aside all the skepticism that is out there. I'm happy to do so, and understand the skepticism too. I understand why it's there, because of the long history of everybody knows nothing works in treating TMD. That's enough for today. I always enjoy talking to you. I hope you gain something from this. I really do. That's the reason I take the time to do this, not to hear myself talk or speak. I do it to try to help you, the practitioners, and ultimately my goal is helping the patients, the 76 million women out there who confuse other symptoms, especially migraine headaches or infected ears, when they actually have TMD. I am Tony Urbanic. This is TMD Demystified. Until next time, I will see you later.